So if we're talking about Medicare costs, there's one thing that seems to have been true at least over the last decade and a half or so that I've been doing this is that the costs can be a lot and they almost always go up. So today we're going to talk about 5 ways that you can bring down your healthcare costs once you get enrolled into Medicare. This is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it helps our channel to grow, but also because it keeps you up to date about the newest Medicare changes, the newest Medicare options, and the ways to make more, better informed Medicare decisions. All right, here we go. So first up today is going to be a program that basically every Medicare beneficiary gets paperwork for when they first apply. And right now, at this very moment, it's probably still sitting at the bottom of someone's important but not organized mail drawer in their kitchen, you know, the one next to the odds and ends drawer. The program specifically helps folks with their prescription drug costs. It's called the Low Income Subsidy Program, or LIS, or usually it just comes on a form with big letters that say extra help. This LIS program is specifically run by the federal government and is based on a household's income. This means that for households who have incomes that are up to $17,220 in 2024 for single folks and up to $34,360 a year for married folks, may be eligible for the extra help. And for those with the lowest incomes, they get the most amount of assistance through the program, like paying for monthly premiums and some or almost all of the cost of deductibles or copays or co-insurances on the medications that they normally would have to pay for themselves out of pocket. As someone's household income grows, then those benefits will decrease, but still, you know, every little bit helps. Also, because of the changes brought about by the Inflation Reduction Act in 2024, the maximum income eligibility is going to change and gets lifted to 150% of the federal poverty level, or FPL. And at that point, it gets a little technical, so we will probably have to do its own standalone video for LIS. But another benefit to LIS program, and I guess this is the last one we'll talk about, is that a person enrolled in LIS will qualify for a special enrollment period, or an SEP. This means that they are going to be able to change their Medicare Part D plans, or enroll or disenroll from Medicare Part D or MAPD plans at least one time every 3 months. So once per quarter throughout the year, except for the last quarter, Q4, because that is the annual election period when everyone can make change. So this can be a big advantage for someone whose prescription needs are changing and they need to make updates outside of that annual election period, which again, October 15th through December 7th, it is. Next up, and a really big help to many of the clients who we have who are struggling with their Medicare costs and just simply can't afford Medigap plans or even the costs associated with original Medicare, is to apply for a state's Medicaid program, or as it's called, Medi-Cal here in California. In the past, previously, specifically in California, there was some pretty stringent criteria to be eligible to get help with Medicare through the Medi-Cal program, and they would have restrictions on income, on assets, so things like houses, cars, even tractors. I had a guy who got declined because his tractor was worth too much. Man, he loved that tractor though. But much of those rules have changed, at least here in California. For example, in 2022, the asset limit that a person could have and still be eligible for Medi-Cal was lifted to $130,000 for an individual, $195,000 for couples, which was good, but still left a lot of those folks who bought their houses in the 1970s for a jar full of change and a few jelly beans in a tough spot, because now their houses are worth over $1 million, and before they were being precluded. But yet, though, this year, the asset limit in California got removed. So now eligibility is primarily going to be based on a person's income rather than their assets, meaning they won't count things like houses and cars and all those beanie babies you got collected up. One day they're going to be worth something. They won't count against your eligibility for Medi-Cal. Getting into the Medicaid program or the Medi-Cal program here in California is a big advantage for really many financial reasons specific to Medicare. First, because folks on Medicaid or Medi-Cal, they do not have to pay their Medicare Part B premiums. That's at $174.70 a month in 2024. Nor do they have to pay any of the copays, co-insurance, or monthly premiums or deductibles for Medicare Part A or Part B. Furthermore, there are specific plans or dual eligible plans, D-SNPs, that are specifically focused on the needs of Medicare beneficiaries who have both Medicare and Medi-Cal. And lastly, and of course, there are many other benefits. But lastly, for someone who doesn't have enough working time in the United States, that is that 10 years or 40 quarters that would give them eligibility for no-cost Medicare Part A, if someone does have Medi-Cal or Medicaid eligibility, they will be able to enroll in either Medicare Part A and Part B, even if they don't have enough working time, and the Medicare Part A premium that would normally be due is actually going to be paid for by Medicaid or Medi-Cal, along with the Medicare Part B premium. So that's quite good. Next up is going to be a program that, unlike the federal low-income subsidy program, is going to really vary from state to state, but most states will have some version of it, which is the state pharmaceutical discount program. Here in California, it operates under its legislative name, which is the SB 393. And essentially what this program is a program from the state of California that allows Californians who also have Medicare to be able to purchase medications that are not covered by their Medicare Part D plans or Medicare at the same rate the state Medicaid program, that's a negotiated rate that the state Medicaid program pays for those medications, or Medi-Cal as it's called here in California. This can lead to a substantial savings because of the fact that Medi-Cal is one of the largest state insurance programs really in the country. And as a result, it has a very intense negotiating power with the pharmaceutical companies. And when they go to negotiate what the price will be for the nearly 40% of the state of California's population who has Medicaid or Medi-Cal, or about 15 million people who are on the program, they get very big discounts. And through SB 393 can be passed on to Medicare beneficiaries in California regardless of their incomes or their assets. Now in practice, there is no need for Medicare beneficiaries to sign up for the program. They just have to be enrolled in Medicare and live in California. Additionally, they would not need to enroll in either Medicaid or Medi-Cal programs to reap these discount benefits. When they go to the pharmacy, they just have to request the SB 393 price, and the pharmacy will provide eligible medications at the Medi-Cal cost plus 15 cents transmission fee per medication. Again, there are many more details to this, like how to find out what is the actual Medi-Cal reimbursement rate for those medications if you're trying to create a budget, but we're going to save that for another full video on its own. The next two methods are ones we have already done a fair amount of videos on. So if you want more specifics on either Medicare supplement plans or Medicare Advantage plans, we have full videos for each. I would say check those out. And either way, the short version is that both have pretty specific advantages and disadvantages that someone would fully want to understand before diving into either. Talking about Medicare supplement plans, these are private insurance plans that basically just help to cover the costs not covered by original Medicare. Save prescriptions, of course. They do this to varying degrees depending on the plan letter that someone chooses, whether that's Plan A, Plan B, Plan C, Plan G, etc. And for example, a Plan G may cover almost all the costs not covered by Medicare, like the Medicare Part A deductible of $1,632 for the first 60 days in the hospital and the daily costs associated with Medicare Part A for the days after those 60 days. But a lower and subsequently less expensive Medicare supplement plan, like a Plan A, may cover much less, but for a much lower monthly premium. So for those folks who have a lot of usages or have doctors that are kind of all over the place, maybe literally and figuratively as far as networks go, MedSups are a much better option because it allows for much more freedom in choice of doctors and networks, but of course, in exchange for a bit more cost monthly. The other side of that is going to be Medicare Advantage plans, which sort of squeeze original Medicare back into that more traditional health plan style, reminiscent of something that somebody would have had in their under 65-year-old plan. Where Medicare as a whole, as a program, doesn't really have, let's say, a lot of oversight and doesn't really try to limit one's care to care that is medically necessary. Medicare Advantage plans, they do. Like maybe a little too much depending on, one's personal situation. They are usually in the HMO style of managed care, and they tend to be less expensive for beneficiaries, and they also tend to include extra benefits to beneficiaries that are not covered under original Medicare, which can be pretty useful and also help to bring down those costs. They will usually typically have yearly limits to how much a beneficiary can spend out of their own pocket on their health care, which is another nice benefit. But what is given up is that no network, no referral, no management style of freedom that comes with an original Medicare or an original Medicare with a Medicare supplement. So again, check out our full video if it still seems a bit fuzzy, because there are some real advantages as far as cost, but there are also some things to consider as well as far as limitations on networks and doctors. So overall, there really are a lot of easy ways and tips and tricks to sort of bring down the cost for Medicare. Some will apply to some, others will apply to others, and some will apply to none, or vice versa, or everything in between. But realistically, if you are not sure, you really have nothing to lose to try to utilize one, if not all, of these programs, whether it is the low-income subsidy program, the Medicaid or Medi-Cal program, your state's pharmaceutical benefits program, or even just plain old Medicare Supplement or Medicare Advantage. All of them can help to bring down those yearly Medicare costs. And which one is right for you is just going to depend, again, on your specific situation and what you can qualify for. Now, if you have questions about these programs or really anything else related to which Medicare option might be right for you, please don't forget to like, subscribe, and follow so you can stay up to date with the newest Medicare information. Or also, you could just give us a call at the information down below, or check out our other great Medicare content on the socials, on YouTube, on Instagram, because we have new Medicare content coming out every single week. So, all right, so that is it for today's Michael's Medicare. And of course, I am Michael, hoping that you have a great rest of your day, and goodbye.